You cannot be the fixer of everyone's. People have to own their mistakes and just deal with the consequences. It is the greatest joy and the greatest challenge in the universe.
ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. So speaking of other parts of life that are wild, you have recently entered motherhood. Tell us this journey and lay it all on the table.
Yes. So infinitely harder than what it looks like. You'll never appreciate your mom more than becoming a mom. I literally cannot apologize enough for ages 11 to 18. I don't know. I'm so sorry. I wasn't me. It is the greatest joy and the greatest challenge in the universe. I mean, people talk about it, but they just don't talk about it enough. I need more moms complaining. I needed more moms pulling me by the shirt, coming close, let me tell you. You know what I mean? Listen, you're going to just be you're going to be a shell of a human for a very long time. And then sometime it'll click. I'm still waiting for the clicking part. But
how old is your little one?
She's 4 months and a couple days.
Okay.
So she's just a little piddle, but without going too far down this rabbit hole, so of course, I'm a dentist. So she's born and the first thing I look at is, do you have a lip tie?
Yes.
Even though I'm the referral person for airway. I screen for stuff. I don't treat it. I'm referring that stuff. Right. Yeah. And I don't do tons of peds, but of course that's the first thing I'm going to look at. I'm let me look at your lip, child. So she comes out of me. First thing I see is her lip tie. And I'm like, crap. She's got a lip tie. And I know my husband's mouth, and this man has all the things, right? High vaulted palate, sleep apnea, receded. So that's why I was so on high alert with her. So I'm like, crap, you've got your father's genes. So comes out. And so we did tongue-tie lip revision when she was 6 weeks old. Okay. I didn't do it, but I had another dentist do it. Yeah. So I don't know about you, but maybe because I don't do it and I just refer for these things, I was very idealistic about this whole experience. My understanding is we laser it. She's happy. She feeds well. All is good. That has not been the journey that I was personally on. Not to say that's not what other people's journey's been on. Yeah. But ours resulted in in feeding. I mean, we're still seeing feeding specialists. Okay. We're still not gaining weight. We have more compounded issues post-release than we did pre-release. So that's also made things a lot of a challenge because, we're just working on her oral motor skills, her feeding and things like that. But it's an experience unlike any other. I mean, I think especially for the woman, because at least from everybody that I've talked to, because the other thing people don't warn you about is how much you're going to hate your spouse. I was literally Googling, is it postpartum to hate your spouse, or is this just is this a normal amount of hate, or is this extra hate? But then I talked to enough people and patients and things where I was okay, good. We all hate them, right? We all despise this person. But it's all of a sudden it clicks for you as the mom, right? Your entire life is caring for this human. Yeah. You're just being the sacrificial lamb. You're doing all the things. Meanwhile, depending on who your spouse is, they're I'm going to the gym. See ya. And I'm just enjoy the gym. I haven't had a shower in weeks. Yeah. Yeah. Just all the BS where I literally am this child's nourishment. I'm their source of comfort. I'm the everything here. Yes. My whole life is uprooted. Meanwhile, everyone around you is still functioning the same. So it's crazy. I will say from a practice ownership standpoint or a dental standpoint, again, I always try and find the blessing and everything, the teachable moment and stuff. I feel for me, one of the things that I was very aware of going into it that I think is really helpful or really good is that I'm always the fixer of things. And I'm always the like cleanup duty, right? So if it's like, okay, like we have very good systems and protocols in place, but if there's something where I'm like, I know this person always forgets to do this properly, or I know this always gets missed, I just would always do the thing, right? Because that's, you just kind of keep the shit moving, right? And you also have to pick your battles to a certain
We were
degree.
literally just having this conversation earlier today, so this is
I think this
so
whole
timely.
conversation, you must have like been
Just
hearing
been
everything we were
Yeah, have you
talking
been
about.
talking to our therapist?
But you know how it is. It's like, okay, like you have to do it or it's not going to get done. So at the end of the day, like you're going to do it, right? Like
Yep.
if the assistant forgets to like always make the lab case and the computer or whatever, right, to track it, like, okay, like you can only tell people so many times, you can only have it on so many checklists. You can only, like at a certain point, you're just like, I'm just going to do it because it has to get done.
Yep.
While when you're out on maternity leave, like you're not there to be that person. So it definitely, you know, shook things up, had some different challenges and it still has some different challenges, but it was a good thing of like, you have to be able to step back. Like you cannot be the fixer of everyone's BS. Like there reaches a point where this is it. Like people have to own their mistakes and you, to a certain degree, sometimes have to let people make those mistakes and just deal with the consequences, right? And so this very much forced me to do that and to have to step back. Like I literally cannot be there to do all the things. Like you guys have to function. So
do you feel like it's helped your team to rise to the occasion?
I think so. I would say, and again, I will say I'm very blessed with, I have a hard time finding, I have like one phenomenal admin. I'm still having a hard time, I think, finding my ride or die admins. The rest of like my clinical team, I would fall on the sword for these people. Like I would take a bullet for them. And I would also like kill someone if they tried to steal them because they're just, they're phenomenal. They're phenomenal clinicians. They're phenomenal human beings. So I honestly feel like when I say like I pick stuff up, it's not that they couldn't or that they weren't able to. It's, I think to a certain degree, they have a lot on their plates. I understand that. I'm grateful for what they do. So it's not so much like, you know, I'm irritated doing it. It was more just, hey, it just makes everything move faster. Why tell you the same thing 1,400 times? If you're not doing it, I'm not assuming it's because you're a jerk, you don't care. You're just doing a lot of stuff. So, you know, so all that to say that, yes, I do feel like they rose to the occasion, but I think they always would have. It was just more me using kid gloves with people when I probably just should have more been like, okay, like, no, you got this, you do it. And if you don't, like, you deal with the consequences, right? So yeah, and honestly, they're lovely. Like literally one of my assistants, like this is the level of humility and just sweetness. I literally gave her a raise at the beginning of this year, and she literally messaged me and was just like, "Oh, doctor, I don't deserve this. I make too many mistakes. Like, I'm not deserving of this." And I was like, "You're like the most deserving of." Firstly, I can't even think of one mistake you've made. So if you do, you do a really good job of hiding them and keep hiding them because they're not impacting me. But like literally, like that's the kind of people I work with, where it's just like, no, you definitely deserve this and more. Like you should be paid $1 million if I had it. Yeah. So, you know, yes, I will say, but I will also say it took me years and years and years to find these people. I did not have those people 3 years into practice. I did not have those people for a very long time. It's the journey of finding your tribe is the hardest part. Like making the culture, finding your tribe, it's really hard. And in all fairness, I was not the same leader I am now than I was then. And a lot of it is reflective of that. Like it wasn't so much even just the people, it was how I managed them. It was how I led them. It was how I, you know, it's hard. It's hard, right? Because, you know, like you maybe can balance like professional and personal and like really seamlessly, but other people can't always do that. And so if you're there kikiing with people and eating lunch with them and, you know, being really invested with people, like you may be able to understand that boundaries, but you can really muddy those waters. And for me, I really struggled with that because I do love people. I want to have fun at work. Like part of wanting to have my own practice is I had some really bad bosses in the past at other jobs and I didn't want that, right? And at the end of the day, like I think work-life balance is important. Like, you know, I don't need people living to work. We work to live. So I'm totally fine with somewhat of like a relaxed, friendly, fun mentality. Like you want that, but you still have to get the job done. And not everybody understands that delicate balance. And that's where things can be a struggle. And it took me way too long to understand that and be able to do that, honestly.
What tips would you have for dentists out there that are struggling with muddying the waters and setting boundaries, but also, like you said, you want it to be a fun atmosphere, culture, but also having your team know that, okay, it's a job that needs to be done and we need to get it done.
Sure. I think that it is a very delicate balance. One thing that someone told me that I think was very good advice is don't eat lunch with your team, because I always ate lunch with my team. And, when you do, it's just like a different vibe and you're doing all the things. When I stopped doing that, I do feel like it did make an invisible type of separation that was good in a certain sense. Cause it's like, and it's not that I mean, I still know all their kids' names. I still go to kids. I mean, I go to, their track meets, like I'll do this and like, I still love them and their families.
Yeah.
Right. But something about that separation did help. And that was one of the easiest, quickest ways of doing it, right? Is that separation. So I think that definitely helped. And I think that having like structured time for that kind of engagement and fellowship is helpful too. So like having set time outside of the office where we're all going to go to a pottery place and paint, or most recently we went to like a little plant place and made like little, what do you call those things? But like plant terrariums, right?
Terrariums.
Like, yeah, like whatever, like having actually scheduled, coordinated, this is our fellowship time to like relax and have fun and chill, versus like trying to fit that in on the job and do it all at once. And so like when I'm at work, I'm in my office. I'm not like, if there's spare time or downtime, I'm not just like chilling, chatting with people. I'm being productive. I'm doing things. And again, like one of the biggest ones was really honestly just like not eating lunch and having that sort of like break room mentality, I think was very helpful. Also too, I'm very, and I think everybody has their own style. And again, everybody's style works for them. Like I'm very honest and forthright with people. And I set that from like the very, very beginning stage, sometimes the interview stage, but if not the interview stage, like day one of just, hey, listen, like I'm a really honest person. I don't like anything passive aggressive. So you're always going to know how I feel, whether that's good or bad. Like I'm going to communicate it honestly with you. So if there's something that I feel like I need to discuss with you, I will absolutely discuss it with you. But also like if something's not an issue, don't internalize it. Don't second guess it. Don't think you're trying to read my mind. If I'm not talking to you about it, it's not an issue. So please don't dwell on that, because I find a lot of people do that too, right? It's like, okay, maybe they didn't have something set up properly or whatever. And I'm like, hey, like, where's this or what's that? Right. And then all of a sudden people are like spiraling. They're like, oh, she thinks I'm so dumb. She thinks I don't know how to do this. Like, oh, this is such a problem and da 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 da. And it's like, actually don't think that. I just want to keep moving on with my day. But I also am not the person or have the luxury or the time to be like, hey, honey, sweetie, boo boo. Like, okay, so, do 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 do. Like, it's just like, I want to work. I want to get through my day. Right. So if it's like, hey, please in the future, just make sure when you're setting up for implants that you have, the prescription ready to go in the scanner, just makes life easy. Right. Like, I want to say it like that. And then I want to go see my next patient. I don't want to sit there and like, if you need help with that, let me know. I'm happy to help you with it. Like whatever it is. Right. Like I just set that up front so people know. And then again, they're not internalizing. If I don't think you're dumb, I don't think you're incapable, I don't not want you on my team. If that was the case, I would talk to you. Right.
Yeah.
And then I own it and I do that stuff. Right. So if there is something that I'm concerned about, right. If I need to have like, I'll call it like my come to Jesus moment. If I need to have a come to Jesus, like I will have it also. Right. But I'll have it at an appropriate time, not with a patient in a chair getting haughty, not whatever, not even to, I will say, if someone's already having a bad day and they're underperforming, I'm not going to get to the end of the day and just also poop on them. Right.
Totally.
Like, I have bad days. Everybody has bad days, right? Or things happen. But I will address it at the right time in the right way. And I think because I do that, then people can trust that I mean that. And it's not just words.
Wow. There was so much there. But I think the part that I took away from that is if you are honest and upfront, it actually, Ronnetta and I talk about, like, I'm very conflict avoidant, and you've just in this conversation reframed it for me of like, that's not necessarily conflict, that's honesty, and like that's actually kind, because then they're not ever second guessing, like you said, that I have different intent. It's if Correct. I can have those conversations in all of those ways, it only strengthens that relationship to know that, no, I'm not actually mad at you. Like, I hit my elbow off the door on my way in because I don't know where my body is in space, or like, my cat threw up on my shoe this morning. Like,
well, even think about the relationships you have that you value, right? Like your best friend is so honest with you. Like that's the person that's going to tell you like your friends are the people that like whatever vibe you're on, they're going to vibe with you, right? Like they're like, yes, girl, he sucks. Like, like, like whatever, right? But like your best friend is the one that's going to look at you and be like, no, you're overreacting. Like that was not that big a deal, honey. Like he missed your call for 1 minute. He was working. It's okay. Yeah. Like, you know what I mean?
Yes.
It's like the relationships we value most and are the deepest with are the ones where we can be our most genuine self, and other people are comfortable to be their most genuine self. Right. And it just works so much better that way. But not only that, it's just so much more comfortable. Like, I don't want to walk into, because I've been there, right? Like, I don't want to walk into my office and be like squeezing my butt cheeks, like, like I have to walk by this person, or I'm going to have to interact with this person. Like, nobody wants that. Like, you just want to be like, like,
so true.
It's so true though. Like, who wants to work in that environment? I don't, and I don't want that for other people. And if it gets to that place, then again, that's where it's like people come into your life and people also exit your life at the right time. Like, if we're just not in sync the way we need to be, like, doesn't make you a bad person, doesn't make me a bad person. It's just like this dynamic doesn't work for us anymore, and that's okay. Being in ownership, I used to like having to fire people used to be, oh my God, I would lose so much sleep. I would stew. I was like a hot mess. And it could even be like the worst person. Like, I literally had one team member one time who organized an event. It was a 2-day event, organized it, and then like showed up like an hour late the second day and tried to tell me it's because she didn't know where the parking lot was, even though she came the day before. Like, just like dumb stuff, right? Like, she was just like she just didn't care. She was just like not a good team member. Like, she shouldn't have been on the team. Like, I remember even like terminating her when she gave me like 400 reasons to do it. It was just like, oh, I feel so bad, right?
Yeah.
But when your mentality shifts and it's less about like, it's nothing personal. Like, I'm not targeting this person. They're not targeting me, right? When your mentality becomes, I have a culture, I have a team of high performers that I have to protect, right?
Yeah.
It's so different. And like, as sick as it sounds, like, I love firing people now, because if I fire someone, it's like I'm being mama bear. Like, that assistant I told you about, she deserves nothing but the best teammates, right? Yeah. And all of my teammates are like that. They're phenomenal people. They don't deserve anyone that's going to come in and not give the same love and dedication that they provide. And so then it becomes really easy to be like, hey, like, you're great. It's just probably not a good fit, like, for what we're looking for. Like, it's just not a good fit with our overall dynamic, but like, you're wonderful. If you need anything, let me know, This device that I'm on that my headphones plugged into is about to die. So I'm going to sign in with a different device, but I don't have the headphones. I'm so sorry. I hope that doesn't mess anything up with your audio quality.
You're good.
Sorry.
You're good.
Let me. I thought that thing was charged, but apparently that died much quicker than I was thinking. So sorry.
You are fine.
It actually doesn't sound bad on our end.
Okay,
Sounds good to you, Savanah?
Yeah, no, everything looks good.
Okay, great.
I did want to pivot a little bit to kind of talk about, we talked about the journey from, the first practice to the build out. And so I love to hear about that whole journey and your journey with ADEC and, all the things.
Yeah. So the first office I bought was 1,000 square feet. it did not have a straight wall in it at all. Like snakeskin wallpaper, green carpeting. I already told you about the cactus. I'm just trying to paint the picture for you. The patient bathroom, I'm pretty sure was like maybe a dark room or something. The patient bathroom was so small. It was like an airplane bathroom, but it was so small that you would have to sit sideways on the toilet. Like your knees couldn't, like, it was, which was honestly one of the funniest things, because when we did the new build out, every team member, every patient, they were all just like, the bathroom. And I'm like, I know, but there's other things, guys. Like, what about the rest of it? Everybody, it was so funny. Everybody would just come in and be like, this bathroom is glorious. It's like, I know, but like, there's other nice things.
Yeah.
So it was not hard to, upgrade. We didn't even have room for like a piano, CBCT, any of that kind of stuff. It was so small. And that's also too, to be honest with you, why I ate lunch with my team and got in that habit, was because we didn't have a break room. I had an office. That's where everybody ate lunch. Like there was nowhere else to do it. Right. So they would just like sit across from me at my office, eat lunch. I'd eat lunch, and we'd, be delinquents together. So I spent 3 years at that practice. There was 4 years. It was a 5-year lease, but in my purchase, I made him buy out the fifth year. So there was only 4 years, because what I basically told myself is, I'm going to try this for 3 years. If it works, then I'll transition to the new office. And if it doesn't, then I'll say, cool, tried it. Like, no harm, no foul, like pivot, right? So I practiced for 3 years. I left the fourth year vacant because I didn't necessarily want another dentist to like also come into that space right away. And since it was already plumbed and stuff. So by the third year I was fortunate in that there was a lot of dentistry to be done in the practice. So that's kind of the good thing about a situation like yours as well, right? Like it's hard because like the attrition of patients, I mean, I probably lost 75% of all the patients. I mean, truly lost so many of the patients. But the ones that stayed had so much genuine dental needs that I was still doubling his production like every month from pretty much day one. But probably just taking the x-rays, quite frankly, just taking x-rays. That was probably like an extra, who knows. But so it was profitable from the beginning, which was fortunate. And again, I lived within my means. I was savvy when it came to that kind of stuff. So after the 3 years, then went back to the bank, took out a nice big loan again, and did the new build out. So that was super fun. The contractor that I used was wonderful. I think that was a big part of it being such, I'm sure, a positive experience, is he was just a lovely human. I still have a great relationship with him to this day. He had been working at another company, and then he kind of split off to do his own company. And I was like one of like his kind of first offices. So I think he had the time. He wasn't super busy. He had the drive, like he'd be in there on like Sundays working. And also he wanted it to be spectacular because he wanted, it was his showpiece. Like he would bring people to my office all the time afterwards to be like,
cool.
That was like what he would show off. And he became a very well-known builder around our area and did a lot of beautiful offices. But so that helped really from an aesthetic level, because the contractor one time brought flooring samples to our old office. I was like, what flooring do you like? And my team at the time all like bombarded him with like all these opinions. It was like very overwhelming. I could tell he was like, this was a mistake. I'm never doing this again.
Yeah.
And after that, never saw the guy again. I didn't even pick a paint color. He picked everything. I literally picked nothing, which I was fine with. I told him, I was like, listen, I'm focusing on this. Like, just make it good. And he literally just like built my office. So that was, very helpful. And then, obviously getting to go to Oregon and see ADEC and see their facility and really understand the difference. I think especially it's, we're always balancing, right? Like you want to be thrifty, you want to make smart decisions, but not at the cost of your business and being able to function. So like for us, I mean, you guys know, like if you're down an op, like there's nothing worse than being down an op or having a compressor out, or like there are certain things where you're like, splurge a little. It's okay.
Yeah.
Like pay for the quality.
Yes.
Right. And, I'm glad that I had that mentality, and I think did that. And because I work with a lot of anxious patients, I really like rear delivery for my units. So, we have everything set up in the back. That works really well for me and my workflow and how I work. I'm like 3 feet tall. So it's also very helpful because I stand a lot and it's just the right flow for me. So yeah, so was able to work with ADEC, work with their team and, get everything just the way that I wanted it, right? We have like the pass through x-rays, which I like. My team, I didn't think they would respond well to nomads. And, I know that they like kind of a wall mounted x-ray unit. So we're able to do that. Obviously, with ADEC, everything's very modular. So you can really customize it, which also worked really well for us because my practice has really gone through like a lot of different changes and different things. Meaning, like when I first got in there, I was still the like one doctor with 3 employees, right? So
Mm-hmm.
we had things organized maybe with trays or maybe like in one type of system. But then that practice also grew to a point where I had 3 additional associates and like 20 team members. And
Yeah.
that workflow looks totally different, right? But
Yeah.
because everything is so customizable and modular, we were able to make everything always work. So it was like, okay, well, now instead of this system, we want to do it like this or whatever. And so that was very helpful in being able to always kind of adapt to like what the practice would look like or how we wanted things to be. And yeah, so it was overall a positive experience. I got my surgical suite, which was awesome. I will tell you, when you're
Yeah.
working in cramped quarters all the time. Okay, so my current office is only 2,000 square feet. But I swear to you, when you come from like the little nook to like an office like that, even though it's like not even that big, I was like tired walking up and down the hallways, or I'd like run because it would like
Yeah.
take me so long to get
Yeah.
somewhere. It was like, I think about it now and I'm like, how comical that like, because I went from like 2 steps to like 20, and somehow those 20 were like, I'm
Yeah.
coming.
Yes.
And I'm just like, oh my God, this is ridiculous. Like, and now, to be honest, now I've reached the point where I really have to consider like the next build out and the next move. So I still rent. I
Okay.
didn't want to go into more debt and deal with that. Like, I'm kind of like the baby steps. So first I was like, let me get the practice right. Then I was like, let me get the
Mhm.
practice right. let
Yeah.
me get the patients right. Let me get the practice right. And now it's kind of like, now I'm at the point where I'm, going to hit the 10-year mark on this lease. And it's kind of like, okay, well, now do I need to get my big girl pants on, go back to the bank, take out the next loan and do the next
Yeah.
chapter of like owning the real estate and kind of planning that. So that'll be kind of the next iteration.
Yeah, we kind of was talking about this a little bit earlier, how when I bought the practice, I also bought the real estate with it too.
That's awesome
Mm,
though.
it is, but it's nerve-wracking too when it's time for that build out and you
Yeah.
got to go to the bank and do that.
Yeah.
And you know how construction is.
Yeah.
It's a headache. So,
It's a lot, but you know what? You're smarter to do it now. Part of me wishes I had done it even the last time, because what am I doing? I mean, it's like renting a house versus having equity in your home, right? Like, I've paid so much in rent. I could have
Yeah.
just done all the things, you
Yeah.
know? And it's nice in that, there's obviously different ways that you can have different tax incentives or different LLCs and stuff like that. There's just so many different ways of doing things. Like, I don't do too much crazy stuff or play a whole lot of those games, but like, Walmart has a whole separate LLC for their parking lot because 90% of their lawsuits happen in their parking lot. So they keep that super poor. So if anybody sues them, it's like, yeah, sure, you can have 100% of zero, right? So like, there are some really crafty and smart ways. Like, I remember my program director in residency telling us to have like a separate, I don't do this, but it's smart,
Yeah.
but like have a separate LLC for like all of your equipment versus your patient
Interesting.
charts. Because if someone were to be upset and litigate, it's like, they can't. And coming after your actual like patient chart business, it's like, yeah, that's cash poor. There's nothing in there. Sure. Have at it, right? But again, when you have the real estate and you have the building, you have like you do have different ways that you can protect yourself and your assets a lot more, which I think is nice in certain regards, right? But to your point, it's always a headache, right? More money, more problems,
yeah.
girl. Like, and I don't know about you guys, but I definitely think too, like, we're dentists are typically like type A people. Like, we're not exactly like the cowboys, the like entrepreneurial business people who like you have to be okay with risk. You have to be okay with debt. Mm-hmm. And like, I think for our personality types, it's like, ugh, it just feels so daunting. But the reality is to like be profitable and actually like make real money, like you have to have debt. Like all these people, they all got debt. Like none of them are, all these like rich people and all these business people, it's all business debt, right?
Yep.
And so sometimes like just being comfortable with that is definitely hard. And I definitely understand that because that's part of the game, but it's definitely hard, I think, to be like, okay, I'm just going to be $1 million in debt again. Like, sounds good. Like, all right.
Sign me up.
Yeah. All right. I guess that's what we're doing now. So, 100%. Yeah.
Meredith, this has been awesome, and we want to be respectful of your time and not keep you from your baby for too long. But we have one sort of last question we like to ask our guests about. So if you had to tell your dental school self some advice, what would you go back and tell them?
Yeah. So, I mean, there's so much I would say, but I think the most important thing is be kind to yourself, give yourself grace, because, we work so hard to get this degree. You're so focused, you're so just like myopic on the dentistry, especially in school, right? Like in school, if anything isn't just absolutely perfect, it just like ruins your life, it ruins your day. You have all this just negative self-talk. You just think you're like the worst human. And then you get out in life and you realize that we are human. And as long as you're doing your best every day for everyone, you own mistakes if and when they happen, right? That it's okay, and I think it's okay to give ourselves grace. I think it's okay to look at a bite win in 6 months and be like, you know what? I actually don't love that. Can I redo that for you? Or just, know that like some things are easier than others. And like, that's all part of it. And it's all okay. Everything is not the end of the world. Everything doesn't have to be a big deal. And you're going to enjoy your career and your life a lot more if you can do that. So like, let it go. The like obnoxious 1-star review that is totally bogus and makes no sense. Just like, let it be. Like, it doesn't matter, whatever it is. I think that that's probably like one of the most important things. The other thing I would say too, though, is I think it is really important to always stay curious, right? Yeah. So it's very easy to get complacent. It's easy to kind of be like, oh, well, I don't want to spend the time or money learning new things. I'm already in. I don't want to, take the time away or the money or whatever. And I think that it's really important for your practice health, for your mental health, for just the profession that everybody does advance and that you do learn and you don't get complacent. And just because you're like, well, this works for me, it's worked for me 100 years, like this is how I'm going to always do it. Okay. But you know what I mean? Yeah. Like push the envelope a little, right? Like see, but like, I guess the question would be like, but what if it could be better? Right. But what if you could do more? What if you could help more people? What if you could do it with better precision, better efficiency? Right. And that's kind of one of the beautiful things about being a dentist in this age with the way the technology unfolds and the way things are. We have more treatment modalities than we've ever had, right? We have more opportunities to help other people to make the dentistry more accessible. I don't want to get too far down this rabbit hole because I know we're wrapping up, but like that's the beauty of having like 3D printed materials and milled materials, right?
Yeah.
We don't have just the like, Key or Lexus anymore, right? Like not Lexus. I should have picked something nicer than Lexus, but you don't have like the Kia or the Lambo anymore, right? Yeah. Like you have like a full grade of everything else in between, which is great. Like, so, I've had patients where they've literally come in with a missing front tooth on a layover and we're like 3D printing, something so they can get through, their flight and stuff, right? Like, or even patients who can't afford, I have one case that I love showing people where it's, if you look at the picture of this girl's mouth, she's like young 20s. If you were to look visually at her teeth, you're like, this is complete dentures, top and bottom. Like there's no way around it. But then you look at her x-rays and you're like, these are all restorable teeth. It's just like gross buccal caries, tons of plaque. It looks way worse than it is.
Yeah.
But, the average 20-year-old can't afford a full mouth rehab. Yeah. So what are your options? You edentulate this girl at 20 or you
buy some time.
And so being able to have like other types of materials and technologies to say like, well, hey, why don't we 3D print you a full mouth of crowns, and through the next X number of years, pick 2 and convert them to ceramic every year, right? Or whatever it is, whatever you can do. If it's 2, if it's 3, whatever. And we'll just slowly convert these through the years, but we're going to save you being in dentures for the rest of your life, hopefully. So stay curious, keep learning, push the envelope. Just because you do it one way and it works doesn't mean it's not worth learning, even what not to do sometimes, right?
Yeah.
Like it's okay to even learn things and be like, I never want to do that. Like harvesting tissue from someone's palate, I never want to do that. And I understand sometimes you can't, use allograft in certain situations and whatever else, right? But like, I don't want to do that to people, and I don't do that. Glad I learned it. Good to know, good to understand, but like not for me.
Yep.
So I think that's probably like the most important things to having a good mental space, a good healthy career, and enjoying what you do.
Yeah. Well, this has been so fun. I feel like we will have to have you back on and chat again. Just a couple of gal pals hanging out.
I know. I honestly, it's so nice to like interact with adults. So thank you for
yes.
Not that the Goo Goo Gagas aren't adorable.
Yes.
But like, no, this was lovely and wonderful. And I so appreciate, our time together, and you guys are awesome. And thank you for what you're doing and just your general vibe. It's been a pleasure. So I really appreciate it.
Thank you.
Could you let our listeners and followers know where they can find you or reach out to you?
Yes, you can find me in my daughter's nursery. No, you can find me at, that's where she keeps me 24/7 now. I live there. No, so my office is Gantos Dental Group. We're on Instagram, Facebook, Gantos Dental Group. You can also email me, Dr. Gantos, Gantos. Doctor is just DR, no period in between, at gantosdentalgroup.com. Or honestly, people most of the time will hit me up on Facebook or Instagram, which is probably the easiest way of getting a hold of me. And I'm always happy to help anyone that I can help. I've had a lot of great mentors and a lot of great people that have helped me. So that's certainly how we advance a profession, by all means. So anything, typically, I would say practice ownership related, technology related, design, equipment, stuff like that is oftentimes many of the things I talk to people about. And I'm always happy to chat about whatever. So
awesome. Well, thanks everyone for listening in, and we'll catch you back next time.
Alrighty. Thanks so much, guys. I'll see you. Have a great day.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr._Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adec.com/find a dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.